we get together and man, we might go for a ride. We might catch a car show. We'll go eat somewhere and talk about cars. But that's what it's all about. So, uh, Mike, it's all yours. Take it away and tell us some cool things because there's a lot of things that we just normal everyday Americans can't keep up with all these changes.
Well, thanks, Foster. Let me get to the right screen here for 1 second. Okay.
All right. And if we look alike, guys, because we're brothers.
Well, I swear we're brothers from different mothers.
Yeah. Yeah.
But
Yes.
you know what? I recollected last week because I put on socks and hard shoes. I've been wearing flip-flops other than that one event since April 26th. I think this is the new work attire.
Yeah. Yeah. I think so. We're constantly.
Let's hope so.
Yeah.
Can you hear me okay?
Yes.
Okay,
Yes,
can
sir.
can you see my screen?
Yes.
All right, let me start here. Get to the beginning, which is always a good place to start. And just so you know, I am recording this. Hopefully, the recording will come through so that even if the video is a little garbled at your end, what I do is I'll render this, which is kind of a compression technique, and then I'll upload it to Google Drive, and I'll make it available for John at Frisco Connect and also my YouTube channel. And the reason is that and for the last 2 years, since remember times before the pandemic, everything is in a state of flux, which is it may be this may be the new normal. I don't want to alarm anybody or sound negative, but life is about adjusting to change. And my own life, to give you a little bit of background, I thought that 2001 started the end of my corporate career. At that time, I became a single parent after the towers fell and the New World Order at that point. The company that I had started up here in Dallas ran out of cash. We were a startup, and so I ended up at that time spending more time at home and became a single parent. And so boom, from over the course of the invasion of Iraq post 9/11, I became a single parent. I was a Mr. Mom. I looked for work just like hundreds and millions of job seekers during that period of time, and it reminds me a lot of what you're facing now. And through that time, I decided to make a change in my career to something that's more meaningful. And so those of you that are looking at it and those of you that are going through a job search, I just want you to know that I've been there, I've walked in your shoes, and in an area that is very confusing and very complex and horribly regulated and constantly changing, somehow I managed to carve out a career. And I did that by giving information away for free. Now, marketers, and I came up through the sales and marketing profession before going off into executive management. Marketers call that technique the butterfly effect. And the butterfly effect kind of indicates what we all do. The people like John and everybody that you talk to, we give stuff that's valuable information away for free. But we don't do it because we're trying to generate leads or business. We do this because this is our passion and our commitment, and what we do, that is more important. And in my case, I decided to step off of the corporate rat race track at a young age of about I'm going to tell you my name, or my age, but it was about 50 years old, and became a single parent and decided, hey, I'm going to do something different. not knowing that this was the end of my corporate career. And I love it. It's a way to give back, but it's more than just giving back. All the people that volunteer here, I know, feel the same way. What I do, I earn some money as a commission-only broker, but what I do, what that does is that keeps a roof over my head, and it allows me to do what I'm really passionate about, and that is to stay on top of healthcare regulations and rules, and be able to afford the opportunity to share that information at no cost with the people that I love. And I love y'all. I know you will go on from this and will be better for the experience, but it sure as heck probably doesn't feel that way right now. So I'm going to go start this presentation here, and let's see if I can get there we go. Here's what's been going on, and this is, I could go back 3 more years, but I want to try to keep this concise. This is this year's timeline, just since January. I could go back from the previous January and put a bunch of other stuff, but here's what has happened so far this year. We had a change in administration in January, immediately announced a special enrollment period that lasted until August 15th. In March, the ARPA, or American Rescue Plan Act, was passed, and immediately thereafter, extra premium tax credits available through healthcare.gov was activated. The reason being, the pandemic is not a time when you want to be out of insurance, or when you're between jobs. You sure don't want to be without insurance, but it's super expensive. So ARPA, part of ARPA had to do with healthcare, and it activated additional premium tax credits. And at the same time, in May, they announced that not only was there a special deal on plans through the Affordable Care Act, that COBRA insurance would be free from the months of April through September. And that's coming to an end here at the end of this month. And this may seem, I was looking this up in preparation for this presentation. I am old enough, I sound like Methuselah, but I am old enough to remember when R.H. Macy Company had one-day sale per year. Well, last year they had about 18. And that's how I kind of feel what is going on with healthcare.gov and Medicare and other rules and regulations having to do with insurance. I can guarantee you by the time November rolls around, some of this information will be changed, and new opportunities and new promotions, if you will be available. The free COBRA ends at the end of September. Now, there's an infrastructure bill that was passed or is actually going through Congress right now, earlier in August. Even though COBRA is expiring now, lo and behold, last week, healthcare.gov, or Center for Medicare Services that controls healthcare.gov, announced that there is a special enrollment period for unemployed beginning October 1st. And if you have, I'll talk about this, but it provides maximum premium tax credit, and I'll explain what that means. But it reduces the cost of insurance as well as your out-of-pocket expenses to probably the lowest amount you'll ever have. There is right now, winding through the House and the Senate, a $3.5 trillion social welfare expansion program that in some shape or fashion will be passed, because it's pretty much unstoppable right now, and I'll explain that. And then you have Medicare open enrollment beginning October 15th, and open enrollment for plans through the Affordable Care Act and individual plans for next year beginning January 1st begins November 1st. Now, I am a licensed agent in Texas and 16 other states, and unlike most people in my profession that may represent one company or two or at the most three, I represent every carrier that's available in North Texas and actually throughout Texas for plans through the Affordable Care Act. There's plans in other areas like Lubbock and especially in Houston that aren't available here, and vice versa. And unlike agents that represent one or two Medicare companies, I count them up, and there's 23 of them that I train and certify for every year. Now, there is an unemployment subsidy tax credit. And I refer to it as a promotion. It's available now. It's a special enrollment period for anybody that received a dollar of unemployment income this year that is available right now. And it ends at the end of the year. So I'm going to talk about some of this. Anybody who has received any unemployment, you can enroll right now through the special enrollment period. And if you have benefited from the free COBRA offer, you may be looking for alternatives now, because all of a sudden you're going to be paying full amount for COBRA, and thinking, oh my goodness, what are my options? Well, I'm going to go through some of the options, but right now you can enroll for coverage beginning October 1st. And if you and all you have to do, it doesn't matter how much your income. The rest of the year prior to this, you would have to have there are income limits as to how much of a subsidy or premium tax credit you would receive. So if you've had any unemployment income this year, and even if you've already enrolled, you can take advantage of this and reduce your premium. In addition, if you have had unemployment income, you will receive not only the tax credit, but if you select a silver plan, you'll also be eligible for maximum cost sharing with very low out-of-pocket expenses. And it's based on the second lowest silver plan in the market. And what that means is that for somebody that's about 60 years old, 40 years old, 50 years old, the maximum out-of-pocket expense, instead of otherwise being over $8,000, it would be about $900. So you can see that there is just a continuous, very similar to one-day sales. I expect this trend to continue at least as long as the Senate and House majority continue, and as long as we're still in the throes of Delta, Lambda, Mu, or whatever comes after it. Now, and it doesn't have to be just you, if you or a family member, including a child, have had any amount of unemployment income, you're eligible for this premium tax credit. And then the whole family is eligible for this subsidy. But the one but is that if anybody is eligible for a group health plan, father or husband, spouse, wife, spouse, single parent, then there is no premium tax credit. So that's important here. So who's this good for? Anybody that has had any amount of income this year, regardless of your income, can take advantage of this. I have actually helped people that expect their premium, their income due to bonuses and different packages, who are going to have to report over $500,000, but are still cash flow poor. I've been able to help them take advantage of the unemployment premium tax credit. I'm keeping politics out of this, okay? This is just, I know we're job seekers here. I know cash flow is king. I'm telling you what you can do and how to best protect you and your loved ones. Now, it's also good for anybody that might have enrolled in a bronze plan, or could have been a silver plan earlier in the year, maybe last November during last year's open enrollment for this year. You can take advantage of this unemployment tax credit if you have had unemployment income this year, or someone in your family has, and you'll be able to reduce your out-of-pocket expenses if you select a silver plan, and reduce your premiums even though you are upgrading yourself from a silver plan from a bronze plan. And I'll talk about some of that. I actually put together some, I'm pretty tech savvy for an old geezer like myself, but I actually put together some flow charts, lucid charts, that'll help you understand what the options are for anybody. Now, and You may not need it now. You may know people that can use them, but it explains all of the different factors that you need to be aware of. Now, this unemployment subsidy goes through the end of the year. There's no strings attached, other than you have to have unemployment income. So, unlike previous ACA or Affordable Care Act subsidies, it's regardless of income. And if you select a silver plan, you get you can select a silver plan. And it is estimated that over 1 million Texans may qualify for this subsidy. Here's how to apply. First of all, it's not automatic. You have to reapply to receive the unemployment income subsidy. You have to attest that you received 2021 unemployment income, or attest that someone in your immediate family had unemployment income in 2021. And you have to either re-enroll to attest, either in the same or different plan. You have the option of switching plans, but if you do change carriers, just keep in mind that by changing from company A to company B, your deductible starts over. That's not the case if you change from a bronze to a silver plan, or maybe you've had a silver plan, but this will reduce your costs and your out-of-pocket expenses for the balance of this year. And with Delta, filling up the hospitals in Texas, this is not the time to be without insurance, and this is especially for people that are, really focusing on cash flow, which is king. Holding on to cash flow and reducing cash flow and maintaining a quality job search is how you can find the job that you really want, and not the job that you have to accept to keep a roof over your head. And again, this is available through year end, but I just have this feeling that this one-day sale mentality is pervading through Center for Medicare Services and healthcare.gov, and something new, another shoe will be dropped later in the year. Now, here's how to apply. You can call me. I'm going to show you what you can do, but you can call me in about 5 minutes. You can call or text. I know how to do this. I've done this literally a couple or few thousand times. And a 5-minute investment will possibly reduce your medical expense risk by over $7,500 per person, and your monthly premium expenses by over $1,000 per person per month. And if you may, I'm a pretty easy guy, and I'm not going to share your information. This goes no further. But if you prefer to do it yourself and you're benefiting from this, when you go through healthcare.gov, if you would please enter my NPN number, which is 775-1382, and my broker ID, that keeps a roof over my head so I can advise and support you, as well as the Dallas-Fort Worth job search community. I'm going to talk about other changes that have been announced that are going to be taking place. And then I'm going to go to the lucid charts that I don't know if I'm thrilled about them, but I'm interested in input to see if there's additional information that I need to add to them, or if they're just too darn confusing. But because the expectation was, and is happening to a certain extent, insurance companies are only allowed by law to make so much money per policy. And unfortunately, that leads to a cost-plus mentality, so they don't really care about cost, to tell you the truth. They just want to know, in fact, they like cost because they're entitled to 10% of whatever it costs, and you can see that in some of the insane regular premiums that are charged. Well, last year, rather than giving that money back in the way of rebates, or some of the money back, insurance companies stopped charging for COVID testing and treatment. That's going to change. Insurance companies, the ones that I'm in touch with, they're starting to now announce that they will be charging for COVID testing and treatment this year. And that may change, of course, if some of these variants take hold, but that's the way it is. There's also, because so many surgeries and tests were held off last year, it's already happening. There's an increase in chronic diseases because of diagnostic tests and surgeries were postponed. There's a lot of missed, very life-threatening and chronic illnesses that are occurring as a result. Now, the other thing that's likely to happen as a result of it's called the reconciliation process between the Senate and the House and Congress. There is a likelihood that there will be a reduction of Medicare eligibility age, and there's talk it may be 60. It's going to be tough to pass Medicare for all, but it's likely it may be 60, it may be 55. There's even talk it could be 50, and that Medicare is the best cover. I can tell you firsthand, Medicare is the best coverage you can possibly ever have, believe it or not. And it is, forget your politics. It's something that has become ingrained and expected over the last 50 years. But it is longer than 50 years, but it is an entitlement program, a government program. Part A has been paid for through our payroll taxes, but the rest of Medicare portions are it's a great program, but it is a program that's subsidized with government's funds. Now, employer health plans are a much higher margin for insurance companies and hospitals. They like employer health plan business because Medicare is a much lower margin. So by lowering them, this is and you could say it's an intended consequence, but an unintended consequence. Lowering Medicare eligibility will lead to fewer people on employer health plans. And from an employer standpoint, they kind of like that because they're required to pay 50% of the employee-only premium, at least. So when this happens, you're going to look for further decline in the percentage of Americans covered by group health plans. It wouldn't at all surprise me at all if they are regulated out of existence, but probably not for 15 or 20 years. Now, here's some changes, additional changes. The ARPA Act, the American Rescue Plan Act, indicated that the additional premium tax credits that have been available through May 1st will continue for all of 2022. Extension of an unemployment tax credit has not yet been announced, but it wouldn't all surprise me if the one-day sale approach to that increases is announced for 2022 later this year. But that's just my assumption or my hunch. You can't count on it. Also, hospitals have been this is actually the law, but they have been giving an extension because, like I mentioned, hospitals and they really don't know they don't know what their costs are. Okay, so they really don't know how to post prices for procedures or for diagnostics, or at least they don't want to, and they're embarrassed. So that is being pushed out to 2022, but that will now be mandated. And I mentioned the expansive legislation, which will increase social safety net, and because of this majority, it can't be stopped by filibuster activities. And I mentioned the Medicare eligibility, age 60, 55, or 50, and adding dental, vision, and hearing benefits to original Medicare is probably also very likely. Other changes. Those of you that are on Medicare or are approaching that age, there's a star rating system used in Medicare that has never been used for plans through the Affordable Care Act. It's now, for the first time, going to be implemented for plans through healthcare.gov beginning in 2022. And this is super news. That holds the feet to the fire for providers and insurers and even agents and pharmacists for objective quality measures, and it's going to impact their bottom line. And it's the carrot and the stick. Those that have a higher star rating will be rewarded in the way of additional revenues from from the government. Those that have a lower star rating, besides the lousy publicity that has for posting it online, that will also cause them to make less money, and it will also cause them to lose business because, at least in Medicare, a company with less than a 3-star rating for the year for being naughty boys or girls the last 5 years, it's accumulated over 5 years, but that leads to a special enrollment period when anybody on that plan can switch to a company with a higher star rating. And in fact, Medicare plans, there's only one, Kelsey Care in Houston, that is currently a 5-star Medicare plan. Anybody in Houston can change to a Kelsey Care plan 24/7, 365, regardless of the special enrollment period or what time of the year it is. And also, this is really good news. This is going to affect in January. Those of you that have ever gotten a lousy, surprise, horrible bill that you wonder how can this be, from maybe being treated at an urgent care facility that wasn't in your plan's network, or maybe you were wheeled in on a stretcher and the doctor in the emergency room was not in your network, and you got a huge medical bill. Well, that's no mas as of January. It's almost not no mas, but it is about 80% of where it needs to be. I would suggest that anybody make sure that you know what plan what urgent care facilities and also hospitals are in network on your in your home, in your county, and on your way to work, because all of the plans at healthcare.gov and most employer plans, if you go out of network, you're out much more significant money, and that will continue even with the No Surprises Act. So it's a good thing to know. Okay, other changes. There are several new health insurance companies coming to Medicare and plans to the Affordable Care Act in 2022. And in Texas and in Dallas-Fort Worth, this is Bright Health. This is a very innovative company. Aetna and United Healthcare. These two companies, Aetna and United Healthcare, bailed out about, maybe about 10 years ago from plans to the Affordable Care Act. Well, they're back. And then other major health insurance companies are expanding to other states: Cigna, Oscar Health, and Clover. And Clover's another company you may not have heard of, but they're tearing it up in the southeast and are in Houston and in Bahar counties in Texas this year, and I expect them to be a major player in the future. And this is
Like Clover, Mike.
Yes, Clover.
Okay.
And this is important too, almost every insurance company in our area is expanding the number of counties in Texas where they have their network. And this is so important because, if you're traveling and you're out of network, unless it's a life and death emergency, there is no coverage for the plans through healthcare.gov unless it's true life or death emergency. And even if you get wheeled in on a stretcher unconscious in one of those other counties, if you're out of network, you're not going to get the network negotiated rate. So expanding in other counties is good for members. And there's similar expansions in Medicare also. Now, I am not permitted by law to speak in detail about Medicare until October 1st, but I know that stuff like the back of my hand, and not only in Texas but in all the states adjoining Texas, California, Nevada, Georgia, south of North Carolina, Ohio, go Ohio State, and Florida. So if you if anybody on the call is in those other states or have friends or relatives, I'll be able to advise as you go. Okay, so now I'm going to go to what is the process? What is the decision-making process? So I've created these, and here's where I need some input from you. I've created some lucid charts, what are basically flow diagrams, and I'll be happy to email them to you. All you need to do is send me an email and put in the subject line Frisco Connect, and I'll email it to you. Please include your cell phone number and your home zip code in it, as if you don't and you want to, I get a lot of people, I'd say probably about half, that ask for help, but then they don't include their contact info other than an email. But this is the kind of thing, I check who are your doctors, where do you live, and it's a private one-on-one conversation that lasts no more than 5 minutes. Then I go off and do my homework, come back, and we have a discussion, and I make recommendations for you. It takes all the time out of it and all the stress out of it, especially in those of you that are married. It enables you to have a conversation with your spouse. I know personally just how stressful a job search is on a marriage. There's maybe death and loss of a child, God forbid, are the only things that might be more stressful on a marriage. And nothing is good in this business except by comparison. And you may have been the biggest, you may have had the best health plan in the past, and you might have had the greatest job with the highest position in the past. It doesn't matter. What matters is making the comparison with all of your options, and then going forward when you're back in the job, and what do you do? And so I've got some flow charts here. I'm going to have to share and stop this and go to a different screen here.
Okay.
Hold on one second. Okay, let's see. Where is Adobe? Show all windows. That would help. Close that. Oh, I know where it is. Let's go to. Let us go to. Here, I think that's it. No, that's pictures. I'm looking for Chrome. Hold on one sec. I'm sorry. I had it up. I know it's on my computer, but getting it to. Oh, here we go. No. I know what to do, folks. Hold on one second. I'll get to the right. I actually have it up on my laptop, but I know you can't see it, so just give me a second here. This will be really helpful if you. It really points out all the factors and what the options are, and it's exhaustive. So it's worth spending some time on these things. And then I've got a couple of slides to close. And you get to see my crazy filing system. All right. Hold on one second. Well, it's open, so pardon me one second. The screening sharing is paused. And I know your time is valuable. This is highly embarrassing. Oh, there we go. Do you see this? No, you don't see it.
Not yet. Not yet.
All right, hold on one second. Oh, here, I get it. All right. Decision Adobe. All right, let me go to, here's a single person. Now do you see it?
Yes.
Okay. The first step is what's your age? Why? Because the options for being 65 and 65 plus are totally different, and also the pitfalls and gotchas are totally different than if you're under 65. So if you or your spouse or a friend or somebody you know is approaching 65, these are the kind of things that you need to know. First of all, let me introduce you to a concept called unbundling. Regardless of what most of us, we go through our corporate life or career just picking plan A from Plan B from that your employer has chosen for you, and you don't really look at other options. So I'm going through this because this is oftentimes, it's a different language, it's a whole different bunch of things, but you really, as an individual, no matter your age or whether you're single or a couple or married, you have to look at every person individually. Yeah, you can enroll as as a family or a couple or parent and spouse or grandparent and grandparent and child if you have custody over the grandchild, but you have to look at every person differently. And if you or individuals in your household have serious, expensive, potentially life-threatening physical, mental, or emotional health issues, yes, okay, anything that you see on here that has a double hash mark on it, these are the options that you should be looking at. If everybody's relatively healthy or minor things, most people, I would say by age 50, over half of the people I talk to are on one or more generic medications, and usually that's a blood pressure or a statin pill or both, and they're low cost, and it's primarily for preventative purposes, and they're great. Keep taking it. But that doesn't count. I'm talking about serious stuff, okay? Either expensive or put you in the ground type of stuff, or stuff that will potentially disable you. Now let's deal with this over here on the left, okay? Forget about Medicare for a second. If you have health conditions that are serious, chronic, potentially life-threatening, you should be looking at COBRA. I just see that I forgot a double hash mark here. I'll fix that. Plans through the Affordable Care Act is also something you should be considering. And you see every other option really doesn't have a hash mark, okay? If you are, and the reason is because they exclude pre-existing conditions, or you may not even be eligible for them. So it does not, it's not, don't waste your time considering them for that individual person. Now you can possibly save money unless there is a one-day sale on at healthcare.gov or through Free Cobra or something like that. You can possibly save money and get a better option with like Free Cobra or plan through the Affordable Care Act than any of these other options. I'm going to go through some of these here. Short-term health plans are something to bridge you, and let's say you have a job, you've landed, but you're not eligible for benefits for like 40 or 55 days. Well, you can purchase a short-term health plan to cover just that period of time, but again, it does not cover things, so you have to be willing to take that risk. There are a lot of bad actors that sell what are called indemnity plans that limit, let's say, $5, $10, $15, $20, $25,000 in medical expenses maximum per calendar year. That they sell those for people as a replacement for health insurance. Bad suggestion. Don't do that. If they're low cost, there's a reason for it. Now, where they do make sense is if you have a plan. It could be COBRA, it could even be a plan through the Affordable Care Act. If you have a plan that has a very high out-of-pocket medical expense risk, or more often these days, if you're traveling, I helped a number of people this past year who were traveling out of their Affordable Care Act plans network, visiting relatives or going on a job search. Well, you can purchase an indemnity plan that provides some level of coverage in the event that you get injured. Remember me, or medically sick while you're out of your network. Remember me saying that there is no network discount. Well, very low cost. I'm talking like an accident plan. Won't help you if you get sick, but an accident plan may. You can get an accident plan with $25,000 worth of benefit for about $25 a month for the month or two that you're on vacation or traveling, and then when you're back in Texas, you can drop it if you want. You can also, and it's rare that you'd want to do this, but there are cases where if you own a business, and it has to be a legitimate business, and you have one other employee, can't be your spouse, but one other full-time eligible employee, you can set up a group health plan. And where that makes sense is if you have, maybe you need a PPO plan because you're traveling across the country. And the plans that are available at healthcare.gov just don't do it. Or you need access to doctors and providers that aren't in some of these other plans. That's an option for you. Medicaid. This varies by state. For Texans, unless you're under the age of 19, or you are pregnant or mother with young children, or you're over the age of 65, you're not eligible for Medicaid. And even in those cases, your eligibility depends on assets and income, except for children's health care, which I'll talk about in a second. I also help people that travel, go on vacations. Nobody's going on cruises anymore, and not that many people are traveling internationally, but you'd be amazed at the number of people I've talked to and helped who didn't realize that their health plan it doesn't matter whether it's an employer plan or an individual plan. There's no coverage other than U.S. and Canada. So rather than take that risk, there are plans that cover international travel. They will exclude pre-existing conditions, but especially with COVID outbreaks, it's a good thing to have, and it's super affordable. About a 2-week. Let's see. Last week there was a couple in their mid 55, about $65 for a plan that didn't cover pre-existing conditions. They didn't have any or anything serious. So it's $65 for a 2-week vacation is not too bad. All right, so I'm going to go over to the Medicare side. Medicare, and this is important for job seekers. Medicare has a big gotcha, and as an agent, our lobbying group has been pushing to eliminate this. But you have to know, if you are ever terminated, if you're 65 plus or approaching that age, and you are ever terminated, you may get a offer to enroll in COBRA. But the problem is, COBRA is not creditable coverage at age 65. So if you enroll in COBRA, you're going to be penalized for not having enrolled in Medicare Part B for the rest of your life. And what's worse is that you cannot enroll until January for coverage beginning July. So, I encourage all HR people that are on this call to make sure you know that when you're, or that your benefits person knows that, because it can cause irreparable financial harm and also healthcare harm to anybody that unknowingly enrolls in COBRA. Now, if you're unemployed and let's say you're 1099 and retired, Medicare Part A and Part B and a supplemental coverage is one option. You can also, if you are, let's say you're legally present in the U.S., you have a green card, but you don't have a social security number, or you're not eligible for A and B, you can actually enroll in a plan through the Affordable Care Act. And I help people. I helped some people last month that were moving their parents from India and also from Canada to live with them, because one from dementia and one to be closer to family, and that is an option to help people. Medicaid at age 65 is an option, but it's based on income and assets, and if that applies, you'd be happy to help you. If you're 65 and over and employed, or in the future will be employed, if your employer has less than 20 full-time eligible employees, you don't want to go on to the employer's health plan. Okay, that's something else that you need to know, and that HR people need to know. If your employer has more than 20 employees, you only have to sign up for Part A if you want to. It's your choice, and that's what your payroll deduction pays for. And then you delay enrolling in Part B in supplemental coverage. And here it's just a cost versus risk versus access to providers through Medicare is pretty darn good. There's also a tax called IRMA that applies to any household making over $174,000 or an individual over $87,000 that can increase the cost of Medicare, that may make staying on the employer's plan more attractive to you. But it's all the kinds of things that you need to weigh as you get closer to age 65. Now there's two types of options. You can go this route. This will cost for someone in their, let's say you're 65, Medicare supplement and a Part D prescription drug plan and Part B would run about $250 to $275 for most people at age 65. And the reason that's important, and you may want to consider it, is because your only out-of-pocket expense risk for the year is, this year it's like $202.50, and it may be $205 next year. It's not very much. Plus your drug co-pays. A Medicare Advantage plan will have a lower premium. You still have to pay Part B, but you'll pay less in premium, and it may come with prescription drug benefits, but you will have out-of-pocket medical expense risk of at least $3,500, more likely $6,000 per year. And what generally happens, and this is what anybody that's approaching Medicare age, you get all kinds of advertisements for Medicare Advantage plans. And they have their place, and I represent every major company as well. But they're never presented with the risk of this option. If you or your spouse ever become chronically ill, where you're racking up medical expenses to the tune of $4,000 or $5,000 a year until they put you in your grave, all of a sudden this looks like this fixed, assured, knowing that you have low out-of-pocket expenses for the rest of your days on Earth, looks like a pretty good option. Now, in a pandemic, you obviously don't want to have you don't want to go out without coverage. But in the Medicare world, if you delay enrollment, or if you enroll in COBRA rather than enrolling in Medicare, one of these options here, then you're going to be hit with lifelong penalties, not only on Part B, but also it will keep you from ever being able to enroll in this. Why? Because you have, unless you delay enrollment by staying on Part A, you have a 7-month window when you first enroll in Medicare Part B, when you can enroll in a Medicare supplement. And after that, you have to answer health questions. So here, no health questions at age 65 and 3 months before, during, and after your 65th birthday. After that period of time, if you have health conditions, this is your option. And if you have chronic health conditions, and I have a number of clients that come to me that do and didn't know that, and they can't get over to this side to reduce their out-of-pocket expenses. And there are special expat I help with. The cool thing is I have clients, about in every continent now, and we keep in touch through Zoom and Skype and all that stuff. And so I get to live vicariously while I'm in my bat cave here in Plano, Texas. Couple of things. I'm going to go to this for an adult couple, and here I've included I'll update the first one you just saw, but there's a couple of other options here I want to talk about. Christian Healthcare Sharing Ministry Programs. I was actually on this myself for 5 years. Great option. Although at least to the end of the year, while this unemployment tax credit is available, that's hard to beat. I can tell you that. This is an option for people whose income is either too low or too high to qualify for a premium tax credit. Those of you that are veterans, thank you for your service. I've helped a number of veterans over the years understand TRICARE and their VA benefits, whether they're under or over 65. And then I'm going to hit one more, and then I'm going to, let's see if I can get to that. And move the screen so I can pull down the next, yeah, all right. This applies to parents too, and it could be grandparents, all right? And this is specific to Texas. You have a great option, and that is called CHIP, all right? Everything else is the same, but you haven't, if you have children under the age of 19, okay, and they could be going to college as long as it's in Texas, but and you are in transition, and you have to income qualify. You don't have to income and assets qualify, but you may be eligible to enroll your children if they're under age 19 in a CHIP, or Children's Health Insurance Plan. It's a form of Medicaid for children. And you can go to texaschildren'shealthplan.org, find out what's involved. And generally, regardless of your number of children, it's like, $50. It's real inexpensive. Another option, if you have quote unquote adult children, or if you have children that are in college, especially if they're out of the area or out of state, some of the college student health plans are awesome. They're fantastic. Now, your child or grandchild does have to be enrolled 12 or more hours, and they're usually PPO plans. Very reasonable. You often have to pay for it up front on a semester or annual basis, at least semester basis. But oftentimes, I would say, if it's available at the college, that's the best option for a student who is attending college, because it'll cover them not only where they're going to school, it'll cover them when they're back home in the summer, or at break, or at Christmas time with you, as opposed to being on a plan through the Affordable Care Act. Well, they would have to enroll in a plan, and they can do that, but they may not get as much of a premium tax credit, so it may actually end up being expensive, another unintended consequence. But it may actually be more expensive for a college student to be on their own in a plan available in the county or the state where they go to school, as opposed to on the student health plan. Now, you may have quote unquote adult children, or in Ohio we call them basement children. We can't do that in Texas, but children who have a job, in addition to any employer plan, or whether they're employed or unemployed, a good option might be what's called a catastrophic level plan through the Affordable Care Act. And this is pretty good for healthy adult children. They don't there is no tax credit for a catastrophic level, but it is super affordable and anybody that is under age 30 can apply. There's a limited number of doctor visits, high deductible. There's some preventative dental and vision benefits, and includes mandated wellness benefits, in addition to mental and emotional health benefits. I cannot emphasize much during this time of pandemic and hibernation and masks and just overall chaos, how important it is to check your friends and neighbors and relatives' mental and emotional health, because you never quite know. And fortunately, almost all group health plans and the plans through the Affordable Care Act, including catastrophic plans and COBRA, include mental and emotional health. And another good, and I know most of you know this, but it's always a good idea to reach out and touch someone, whether it's virtually or not, because you just never know when that can have taken a turn to the worse with someone, and it will haunt you for the rest of your life. I will tell you, it has haunted me, knowing that I could have reached out and just sent a text or a little 5-minute phone call, or a quick email just saying, hey, just checking in on you. Want to make sure you're doing okay. what's going on? You see that the Cowboys are playing the other night, and Ohio State pulled out of, just little things like that can maybe give somebody a reason to know that they're not alone. So enough of my preaching here. You get it. I'm going to go back to the presentation, and then I'm going to shut up and take questions. And by the way, I'm putting up my email and phone number, text. It's always best to try to text me or phone, because especially now that I'm getting in my busy season, I may be reading your email at like 2 in the morning, and so it's really hard for me to keep on top of emails. So,
Hey, Mike,
yeah,
our other Mike Ray had a question.
yes.
A few months ago,
It seems like months.
a few minutes ago. Mike Ray, would you sound that out unless your question has been answered?
Yeah, Mike, you were mentioning that that under Medicare, if the doctors and pharmacists get get star ratings, what happens, or what's keeping the doctors from saying, I'm no longer going to accept Medicare patients, as because it doesn't make any sense for me to have a Medicare patient anymore, because these people rated me below the 3 stars or whatever, and it hurts my rating, hurts my ability to get paid, and that kind of thing.
Well, it's a great question, Mike. It's a moving target. As of this day, even though you hear a lot about concierge doctors that just, they just want a doctor, right? They don't want all the paperwork and all that kind of stuff. But 95.5% of all doctors today do accept regular Medicare. What I'm finding, and it's a retirement thing, a lot of doctors who are specialists, who are my age or older, they may just want, maybe they're the greatest heart surgeon in Dallas, or maybe they have a specialty, and adjusting and adopting to the New World Order, they don't want to go through the effort of setting up a concierge practice. But what you're finding is that what I'm finding is that with original, where you have access to the most doctors, and again, 95.5% of all doctors accept original Medicare. They may not accept a Medicare Advantage plan. Those plans have narrow networks of doctors for the most part, and that's where the specialists are measured on star ratings. Medicare supplement plans, doctors get fairly reimbursed, and even specialists. I tell you, a hospital would have to close its doors tomorrow if it relied on Medicare business. But there are, and the good thing about having done this for over 15 longer years is that I have a little black book of providers. So if you ever need a specialist, I can reach out to my little black book and say, here's somebody that I know, so and so. I won't name names, but I have a number of clients, whether it's for something like dementia for children, or God forbid a spouse, but people that have specific health issues, I'll be happy to refer them. I'll be happy to refer my own personal doctors. It makes a difference, and they appreciate it. But what star ratings does, it's a carrot and the stick, and in Medicare, it's a great way to be able to, those doctors, it's rare that you're finding private practice Marcus Welby type people anymore. Most belong to a practice, and those practices realize that they have to join larger practices or acquire other practices to get large enough to support the IT support and Medicare. And if they do that, then the return is good. The return is that they will make more money because they'll have higher star ratings. They'll be reminded exactly what they need to do every time they see a patient in order to improve their star ratings. I'm responsible for keeping my carrier's star ratings high. So I'm measured, if I mess up, that impacts my carrier's star ratings. and that can lead to they're saying, hey, we don't want you to represent us anymore. So it's a good system, you know, and I think that's been dearly lacking on the ACA plans since the beginning, because there are some horrible customer service and some horrible now you talk a client says, hey, I tried to get through, and would you call them? I'm not calling anybody today. It's the first day back from a 3-day weekend. Oh man, that's an hour on hold with a certain carrier that begins with a B, as in boy, or as in blue. I say, no, I'll call them Tuesday afternoon because I know what it's like. Those kinds of things shouldn't exist, but a lot of carriers and also a lot of doctors, a lot of hospitals, the more that they can be encouraged with the carrot and the stick process, the better off, you know, us as patients and consumers of healthcare will be in the future. So, any other questions? I've just got a couple more slides here. I know you love slides. First of all, you know, like I said, I'm recording this. I'll put it up on, it takes about 2 or 3 hours to render. And, you know, anytime. Oh, also, I'm one of the top 10 guys in LinkedIn in Dallas-Fort Worth on LinkedIn. So if I have a personal, feel free to please reach out to me, link to me. Be more than happy. If I have a personal relationship, and I do with a lot of people in town, reach out to me. Go through my my list of connections. If you have a target company or something like that, reach out to me, and I'll make an introduction if I have a personal connection. Now, again, I'm just reemphasizing. I other than right now, you may have heard my phone ring. I'm a first ring guy. I believe in answering, unless I'm on the phone with a client. I respond to texts and phone calls. I can do that immediately if I'm not on the phone, or within an hour if I am. And then response time on emails, it could be 24 hours or later, depending upon when I can get to it. So. One last thing, this isn't about, with me, I've been blessed. Somehow I've managed to carve, and I gotta believe God has laid his hand on me, just like it has Foster and Mike and Trevor and everybody else here, to find a way of being able to make our mission helping others, and then providing the resources that we need for food, clothing, and shelter. You probably know a lot of people that have been unemployed in 2021. Chances are multiple people and could benefit from this. They may think, because they have a cousin who thinks he knows everything about Medicare, that they don't need help or need advice. Or somebody that's paying too much and didn't know about this new unemployment tax credit. So please forward my contact information. It's not about trying to make a sale. It's just the opposite. Now, on Medicare, I'm not allowed to make the first call. I can make a call to anybody who's not Medicare age. But when it comes to Medicare, people have to call me first or email me first. Then I'm permitted. It's called permission to contact. And this is all at no cost. Where I am compensated is through commission, so you get the benefit of 17 years of experience and staying up to date, current, and expecting what next shoes are going to drop. And it's no cost. So focus your time and your efforts on your next job search, on your job search, and targeting companies. And if you need help there, we're all available to help. And if you know people that are 65 and getting, oh my gosh, it's starting at about age 65 and now even earlier, people get pounded to death with junk mail and robodials, and even people knocking on your front door, and they are confused or don't know what to do, or maybe they signed up for COBRA and didn't know that they should have. Just forward their contact info and instruct them to give me a call. And man, I tell you, Foster called me last week, and it really made my day. First of all, that he was okay, and he was able to call me, that he was able to talk, but then that he gave me this invitation to speak to you today. It really, it's what I look forward to when I get up every morning, and I look forward to helping, if not now, in the future. Couple of other, I'll leave this. This is my last. I know you're going to be glad this thing is over, but hopefully you learn stuff. I'll be available if you have personal questions. You know how to contact me, right? If you just want to, if there's a lot of online stuff, okay, if you just want to see what's available for people that are under age 65, this is a shortened URL for, jo.my.quotes. If you're under age 65, jo.my/Medicare for if you're approaching Medicare. And then, oops, that's, I think I just did it, but anything I can do to help, I'm here, a resource. I'm privileged to be able to speak with you, and I look forward to cheering on your career success in your next position. Thank you.
Thank you, Mike. That's a lot of good information, brother. I'm sure you will be getting a call, and you'll be getting to help a lot of us with a lot of questions that we have with this thing changing so much.
Mike, is all that contact information on your LinkedIn page?
I'm going to add the shortened URLs, but it will be on the. First of all, it's if you want the little flow charts. I saw a couple of things I need to fix, but I'll email that to anybody that wants it, including you, John, and Foster, and anybody else that wants it. And then it'll be in the recording of this for those that want it, and I'll put it on my LinkedIn. That's a great idea.
Okay. There was a question. Mark Elder had a question, but he had to leave. I
don't blame him.
No, he had to leave for another meeting.
Yeah.
He says, where is it? There. He asked about what about flexible spending account plans and the extensions through COVID relief. Do you have any information about that?
Well, the ARPA Act really didn't deal with flexible. There's two types. There's flexible spending accounts. That's use it or lose it. Okay, so that's an employer dictates. They can. That all depends on the wording of the document, the legal document that the employer has regarding flexible spending accounts. Now, there's a couple of other things. One of which is health reimbursement arrangements, which for people under, or HRAs, for people under 65, employers can set up health reimbursement arrangements for employees and put money in a health reimbursement arrangement, and and you can do this on your own too. You can do that in a way that you can pay for out-of-pocket medical expenses. There's an IRS Form 213D that lists what you can't use it for cosmetic surgery and stuff like that, but you can use it for pharmacy, dental, vision, medical, hearing, mental, emotional health, and physical health things. That's pretty extensive. And then there's also for a different type for employers. It's called IC, individual contributing HRAs, for employers to be able to give each employee, and this is primarily for small employers, but they can, rather than picking plan A or plan B, they can provide, say, $100 or $200 or $300 for every full-time eligible employee that the employee can then use to spend on whatever plan that's available at healthcare.gov. And what that allows the employee to do, employee may qualify for a premium tax credit, but which, or subsidy that reduces the cost of their insurance. And if they select a silver plan, then they get the reduced out-of-pocket expense risk. They can use that money in the ICHRA to pay their premiums. So it's a combination of, it depends on, and HRAs mean something totally different for Medicare, but that's probably what he referred to.
Thanks. Well, as you can see, there is quite a cafeteria of things available, and you have to have somebody like Mike to guide you through that for your particular situation. So, Mike, you've covered a lot of ground, and we really appreciate that. And Mike has helped me in the past to because I'm an idiot with this stuff. but it's a matter of, he has the knowledge, and then it's a matter of guiding you through the matrix and the checklist to get down to the information that's most pertinent to your particular situation, and then sorting out the most reasonable options, and then of course the decision is ultimately up to you. But everybody's circumstances are different, and the law tries to cover everything, which is insane. So all those ins and outs can be quite maddening to me. And so I thank you for your help, Mike, and thanks for sharing all that information. And Mike, over the years, has done that. When I first contacted Mike, as he mentioned very briefly, but he's just there as a brother advisor, as a counselor, and the scripture says wisdom comes from many counselors. There's no sales pressure or anything. He just leaves the decision up to you, but he wants to cover all the information that might be applicable to your situation, so that you can make the best informed decision, and easy to work with. So really appreciate your contribution and your service to the community through that, Mike.
Thanks, John. Likewise. Appreciate it.
I love Mike. Only problem is that he's a Buckeye, but that's all right. We'll work around that. All right, everybody. Unless John says different, that is our meeting. Before we go, does anybody have a question? Maybe for Mike, maybe not for Mike, maybe just a question about the network.
Well, there's a couple of things I forgot. We do have a group on LinkedIn called Frisco Connect. It's got over 2,600 members. Many of them are alumni of Frisco Connect who are now employed. And if you join the Frisco Connect group on LinkedIn, there's been a lot of job postings and opportunities posted on that page recently. And so it's a good way to do some investigating. So urge you to join us on LinkedIn on the Frisco Connect group. So I want to be sure and mention that. And the other thing is, don't forget the chat. Many of the people who spoke this morning, including Mike, have put information in the chat. And just be sure and save that so you can get back to it, print it out if you like, or just keep it on your device. And if you can't do it from whatever device you're on, I'm going to put my email in the chat right now so that you can send a request to me, and all you have to do is say, please send the chat, and we'll get it to you.
All right. Thank you very much, John. I want to remind, excuse me. I want to remind everybody, feel free to reach out to me. I am a net weaver, guys. I am I want to say an ex-recruiter, but I don't think that's possible. It's impossible to get out of recruiting. And that's what I do for a living, is connect you guys to people, places, and things. We come up with ideas. We connect you with people that may be a good idea. You might see a job at a corporation that makes sense for you. And me being a recruiter, we can talk about that thing and talk about the fit and whether it's a good idea to apply for that particular job. And then, if we know somebody inside the company, we can get them the help. By way of what I do, I meet a lot of people and help them with the job search. So I try to build a relationship with you guys. So when you get a job, hey, we can talk. Might be somebody else behind you. Pay it forward. Maybe somebody else behind you that you can help land. And so that is what I do, guys. And please link in with me if we're not linked in. One more thing that I want to mention before we go. If you are involved in HR, if you are involved in finance and accounting any kind of way, there is a company called the Thomas Edwards Group that we love, and they have teamed up with the network, and you guys might want to check out the Thomas Edwards Group. They have just started. It's been about 4 months, maybe 5, maybe 6 months ago, started an IT division. And why that happened is because of the relationship and their approach to serving their companies, their client companies. Their client companies ask them for a lot of things outside of what their core function is, because of that relationship. I'll never stop throwing that word at you guys. And so connect with Thomas Edwards Group if you are in any of those backgrounds of experience. And John Ernest, good to see you, my friend. And guys,
good to see you, Foster. Glad to see you're up and around.
Yeah, well, I'm up and around more than I was. I can perform my function again. So guys, thank you. We are here, like John said at the beginning of the meeting, we're here every first and third Tuesday, 9 o'clock. And John and I endeavor to bring wonderful people and impactful people in the network, like Mike Chapman and others. We cover a variety of different subjects. And again, if I can be of any service, reach out to me. I'm right here. You know where to catch me every Tuesday at 9 o'clock.
Every Tuesday, first and third?
Every first and third Tuesday. Yeah, thank God I had already said that.
Yeah.
But John is our technical advisor, guys, for this meeting. So if there's ever a technical problem, call John. It's an inside joke.
If you're really desperate, call John.
All right,
okay,
you guys.
That's it. Don't forget to stay in the chat before you end. And thank you all for your attendance. And Renee Samaniego is here, and she's with Edward Jones.
That's
Thomas
right.
Edwards Group. Thomas Edwards Group.
Hey, Renee Samaniego.
Hi.
How are you?
I am great. I wanted to come because we actually recommend this group to a lot of our job seekers. So I wanted to check it out and see what it's about. But yes, I'm with Thomas Edwards Group. And like I said in the chat, we focus on accounting, finance, HR, admin, and IT professionals in DFW. And we're heavily relationship driven. So I would love to connect with you all. But I really enjoyed this meeting, Foster. So thank you so much, and everyone, for leading a great meeting.
You know, Renee, I don't know if we're connected. I'm about to send you a connection. I'm gonna send you a connection request.
Perfect.
Absolutely. If I can help any kind of way, of course, all of my buddies work over there, and you guys just reach out. We're right here every first and third Tuesday at 9 o'clock in the morning.
Yeah, if there's a fifth Tuesday like August had, we don't meet on that third
Tuesday, on
that last Tuesday. Just first and third Tuesday.
Good.
Yeah, he's been away for a little bit, he's got to get back into this.
I'm rusty, man. I gotta get back in the car,
Oh, I think
John's a good driver. I get in there and I'll let John drive.
You should have a pina colada on me with that background.
Well,
Oh
if you
man,
let,
you know,
if you let,
I
if
need
you let
I need
John
a little
drop,
drink. When they let me out of jail here, I think I'm gonna go somewhere and get me a little drink with a parachute in it or something. You know.
hey Foster, if you're gonna get in a car with John, make sure you talk to Mike Chapman to have insurance taken care of beforehand, okay?
Good
Good point. Good point. It's good to see everybody. I just,
too.
you know,
Absolutely.
this is my life. This is my calling. God told me to do this, and you know, to see Renee and Chet and John and Neil Anson, all of you guys are all family to me. And you know, if Foster says things that may sound weird, but I mean the best for you guys, and I want to try to help you get where you need to go and where you want to go. Sometimes where we want to go is not the best. I'll tell you that too. So I will see you guys. When's our next meeting, John?
The 21st.
21st. That's right.
The day of the autumnal equinox.
Oh, that's right. You're using those big words again, man. Come on. All right, guys.
Thank you, everybody, and thank you, Mike Chapman.
Take care. Thanks so
Yeah,
much.
thanks again, Mike. Yeah, absolutely.
Thanks for the opportunity.
Okay.
Bye-bye.
Bye-bye.
Bye-bye.